Morning, everybody.
Good morning.
Welcome to February. Feels like April outside.
Yeah, 70.
Yeah, it's going to be beautiful today. Thanks everybody for being here. Good morning, everybody in Wichita. I don't know if they can hear us. Good morning.
And yes, we can hear you.
Thank you for being here. Well, we got a pretty full agenda today, so why don't we get started? One thing I wanted to just remind everyone is we are still accepting nominations for the Diversity and Inclusion Award, and actually in the back of your packet you have the sheet on what the award is all about. And just as a reminder, it really recognizes significant achievements of faculty, staff, students, residents, departments, units, and registered organizations. So it's a very broad description of what comes in under that, and really obviously want to really recognize either those persons or entities for their efforts to enhance a more culturally diverse, competent, inclusive university communities. So please give that some thought, and you've got a couple days left to get some nominations for that. We will have the ceremony for that in April 20th, and we're certainly looking forward to that. But you want to say anything about the?
Yes, sure. The presentation for the award is on April 20th from 11 to 1, and we have a speaker, Kevin Wilmot, who is a professor at KU Lawrence, and who is also a filmmaker, and so he will be giving the keynote address for us on that day, and we're really hoping we get lots of good nominations.
Excellent. Sounds good. So please think about it, and think about your friends and colleagues who've been doing great work in this area, and get some nominations to us. We've also time to start thinking about the membership of the committee. Jean, you want to talk about that a little bit?
Sure.
That time's approaching.
That time's approaching. So this will be the first time we turn over the some of the membership of the committee. When, if you recall, when you joined, there was a 2-year appointment, but this first round was a little off because we were new. And so some people are 2.5 years in probably at this point. So, so this will be the first time we'll take new nominations in April. It'll be an online form, and you can nominate someone else or self-nominate. And there's an updated membership list in your packet as well. And Margaret reminded me that the end terms, end dates for some of our folks that are rolling off are listed there. So if you're one that's rolling off and interested in staying on, you would have to renominate yourself.
But you can do that.
But you can do that.
Great. Moving on to our Religious Accommodations Work Group.
I'm
Robert.
honored to present our progress. We had a first meeting on January 17th of the Religious Accommodations Work Group. It really stemmed from contact from Lawrence and my knee-jerk response that we could listen to them, but with patient care issues, we have different problems than they do.
Can you frame the issue a little bit for us?
There's a religious accommodations policy in Lawrence, but nobody seems to be able to really find it. And we don't have one at all. So
So the issues are classes, exams, other
classes,
things.
exams, patient care, particularly religious groups that have repeated need to not have clinic on a certain day. And it might help if I maybe tell a few of the stories that emanated from that first meeting. But Lawrence has a policy, and they're really working around, you're entitled to 3 absences in class during a semester. It just doesn't apply to us. If you think of School of Medicine, students might come to class 3 times in at least the lecture. It just we have podcasting. It just is different, as I suspected it would be. Ms. Bonifield, I think it was helpful to have her on the phone and talking about what they've done in Lawrence, but it's almost, in my mind, it's almost a discard, and we have to start really our own. The discussions that came up, the one that I was thinking of immediately in response to your question was a faculty member was talking about another faculty member. It's not me, it's a friend. But this individual is Muslim and had prayer requirements on Fridays and asked for the clinic to be moved to another day. No. It could only be on Fridays. Well, we're all listening to this thinking, well, this Monday, Tuesday, Wednesday, Thursday. The person eventually left. There was something that their division head, their chair, whatever it was, would not deal with this at all. And so we immediately see our issues are a little bit different. And it was, I can do some Friday clinics, I can't do every Friday clinic because I have these religious obligations. And there was an unwillingness to even really listen to it. And I think that was upsetting to everybody on the committee. But that was probably the best example in response to, framing the issues. The hospital has basically a policy that you take paid time off if you have a religious obligation. They don't have a policy per se except around dress. It comes up periodically, the timing of exams. I think most of those are dealt with. But then again, who should deal with it? Should it be a module director that is confronted with, that's Yom Kippur, and you put an exam on that day? I think for the most part, faculty members deal with this pretty well. But there's no
guiding
overall
framework
policy
that,
for
really.
students. I'm sorry.
There's no guiding framework.
There's no guiding framework at all.
Yeah.
And so is that accurate, Jennifer, from what yeah. So we had a group discussion and people talked about some of the things that has occurred in their experiences at KU Med Center. And, there were, where does this rate in terms of expectations for accommodations compared to disability? And it's different. It's clearly different. And I think in the current climate of talking about diversity, working on diversity issues, then we do need to have a policy. So the next steps were, have the materials come over from Lawrence?
Oh, I don't recall. Natalie was going to start working on a draft.
Yeah, but Natalie's going to work on a draft and then talking about when issues come out of a module, a program, how do we do, is there a review committee, is it a standing committee, how are we going to focus on that? And then really communication on whatever, on the policy that we draft and getting some feedback to see if it works without we do have patient care and teaching obligations at this medical center, so balancing some of that. And our next meeting is on the 22nd of February.
Is there anybody from Wichita involved with that conversation? Their structure is a little bit different, and so they may have some slightly different needs that we need to be sure.
They weren't at this committee meeting, and I think we probably have failed to include them.
I think we need to make sure we do that, because they just may have some slightly different issues given how their clinical arrangement is.
Absolutely, you're absolutely correct.
There, so.
Yeah.
If you guys want to think about who might be willing to join on that conversation.
Yes, thank you.
Great, thank you. Thank you for taking that on. It's a little bit embarrassing that we're having this conversation in 2017. But good a time as any, I guess.
Well, we're getting to it.
Yes. But I think you're right. I think it's been handled very ad hoc to date, and I think most of the time reasonably well. But,
Yes.
But it's been without any guidance to people, so they've had to just kind of
But
do what they thought was right.
the
at
three
time.
excused absence, that does.
It doesn't fit our model very well. Great. Well, why don't we jump to committee reports, as the committees have been very busy. So shall we start with future programs?
Absolutely. So, yes, we've been very busy. We had a community conversation. Dr. Girard was there to lead that. We had Dr. Samari, Dr. Klein were there to support it, and Judy Bordeaux, our immigration expert, was there to just address the executive order on, I won't give you the full title, but we all know on immigration and how that might affect our population here at the Med Center. I thought it was really informative and helpful, very well attended. The room was overflowing, and then we had people on live stream, so there definitely was a lot of interest. And it was really good for me to see that it wasn't just internationals who were interested, and so that's it's just very encouraging that a lot of people are interested in understanding and very supportive of our population. Updates on that will continue to be given through our website. So if you're interested in, how this continues to affect our population, you can go to our website or Judy Bordeaux's website as well. Today we have a Refugee Forum, and we're co-sponsoring that. It's really not our event, but Dr. Martha Baird approached us to see if we could collaborate with her. This is a monthly meeting that occurs throughout the community, and it involves all the organizations who are involved in refugee affairs, resettlement, job placement, services. So it'll be interesting. I've never been to one of theirs, so we're interested to see exactly, what happens. They sit in a big table and everybody just kind of updates everybody on what they're doing and what's been going on during the last month. So it should be very informative. It will also give our KUMC individuals an opportunity to share how they're involved in refugee care. We are in the middle of Black History Month, and this is really Todd Moore and Jennifer Keaton's project. Jennifer, do you want to talk about that?
Yeah, should be a flyer, I hope, in everyone's packet. And probably just want to point out that there's several things going on, kind of ongoing. You may have seen some of the faculty profiles that are on the WIMS bulletin board on the first floor of Murphy. So that's kind of an exhibit we hope to grow each year. And we had a couple new additions for that this year. Those have been posted on social media as well. And there's an exhibit outside Clendening Auditorium, which is about the desegregation of the School of Medicine. And so it's a really nice display, and the folks in the History of Medicine Museum have been really helpful with that effort. So those are a couple of ongoing things. The students have a few things going on too, the Student National Medical Association. And then we have, out of Kimberly's office, the Clinical Culture and Diversity Series and Maria's group. Do you want to talk about that event a little bit on the 21st with... I believe everybody got this little miniature flyer too. It talks about that event.
I don't have much to say. Pamela has been organizing this, but we have a speaker who is coming. The students actually recommended her. They saw her at a conference and thought that she was phenomenal. So she's coming, and we're doing this together with Kim's office, and I think that's all I can say. Do you know anything else, Kim? Pamela has been working on it.
We talked about her in our meeting, but
Yeah,
I think
I can't remember the topic exactly, but
yeah, I think she'll be very, very good. She does focus on a little bit on women's issues, as I recall from her, the information we had on her. So the other thing we're doing is today our culture hour is going to focus on. So it's kind of interesting. So an African student who comes to America and has to deal with the kind of the African American experience, and that kind of just that. Yes, so it'll be interesting. It's not a topic that I personally can speak to, but we have a student who's leading this conversation. So I'm really interested in that, and that's today at 12. So we're excited about that.
Are these streamed?
So
those are not.
These are ITV.
Oh, those are, yes.
The 21st event will be.
It's always,
Okay.
we always put it on ITV, and we've started recording them. We're trying to create like a library of resources. So, but the live stream is an interesting thing because that was the first time I had been involved with something that was live streamed with the community conversation. So that's something I'm going to look into as well because it allows more participation. You can be at your desk.
Yeah.
So I wanted to follow up on that with Maria and Pamela as well and see what they thought.
Okay.
Yeah, I think it's a great idea. One more thing, just to add to Black History Month, that is still kind of in the planning. Our OIP is going to sponsor a night at the movies. It's next Wednesday. We're going to offer like 25 tickets to go see Hidden Figures. So you'll just look for advertising about that. If there's more interest, we'll buy more tickets. But we don't know, with it being a weekday evening and stuff, how much interest there'll be.
And then the culminating event is on the 28th. And this is similar to how we had this event last year, where we're going to focus on research and some of our African American researchers we have on campus. And so we're trying to do a poster session throughout the day, and then over the lunch hour, Jerry Jones, who's part of our cabinet and isn't always able to join us, but is going to come and talk about a project going on in Wyandotte County. So it should be a really good session. And so lunch is provided to the first 50 people. Hope you can be there.
Great.
Or as long as the food goes.
Or as long as the
As long
food
as
goes.
it
Right.
Lunch, so it's as long
Yeah.
as it lasts.
Yeah. And Todd Moore has done a ton of work on this, so
Yes.
kudos to him.
Bless you.
Anything to add from Wichita?
We are looking into doing a couple of documentaries, doing a film screening. So we're still looking into the logistics behind it. But one of them is called Agents of Change, and it's about the campus culture and inclusion from the 1960s and kind of what we can learn from that today. So that's one that we're looking into. And then there's another documentary that focuses on women's history kind of from the 1950s and 60s on up until the present. And that is something that we're looking at doing possibly for next month for Women's History Month.
Excellent. Let us know what you decide. We'll have to take a
Yes, we
look
sure
at it.
will. We're
Great,
hoping
thank
it
you.
works out.
And then just one last thing very quickly, the first symposium, the Diversity and Inclusion Cabinet Symposium will be, it's planned for April 18th. And it's focusing on refugees in the healthcare system. And actually Stacy's bringing me some of these little cards for save the date, so I'll have those by the end of the meeting for you.
You want to talk about the Native American culture then?
Oh, yeah.
As well.
Yes, and this is going to be a very good event. It's going to, we're going to have kind of a multi-event where we'll start out, weather permitting, we're going to start out in the Murphy Courtyard with drumming and some posters and food, and then we'll come back inside for a talk on Native American health and issues, and I think it'll consist more of a panel, right, Jennifer? That's what we talked about. Yeah, we're still planning that, but I mean, it's set, the dates are set, and we have Battenfield and the Francisco Lounge as the alternative location if the weather doesn't cooperate. We will have food, Native American food will be catered for the events. And what else on that, Jennifer?
Yeah, we're just hoping the weather is nice so that we can have the performers outside, so that it'll be
really
loud and colorful and beautiful. And
Yeah.
so, yeah, it should be fun.
Do you have the date of the powwow that Chris Daly's team
Yeah, I
does?
think it's the
'Cause
first weekend
They're
of
kind of
May.
It's like
always
May.
they're always looking for volunteers for that as well.
The powwow that's in May? Or,
Yeah, I think it's
May
the first
5th.
weekend, May 5th sounds right.
If you're not familiar with that, they have a big powwow down at Johnson County Community College. Gosh, I don't know, it's in excess of a dozen nations actually come together for that, and it's really organized by KU, and it's really a health screening
Yeah.
powwow. So they have all the traditional things go on with the powwow, but a ton of health screening goes on around it. And they're always looking for volunteers for that, so we'll be sure we get that out as well.
Was one of the things that we're hoping that the event here would help with. It's kind of a preview and also have people sign up to
Good
volunteer.
idea.
So.
Great. Excellent idea. Wonderful. Core values.
So we already talked about the Diversity and Inclusion Award nominations. Just a couple of reminders on that we are taking nominations for both individuals and for groups, and we will be giving two separate awards for those categories. So when you're thinking about who you want to nominate, think about that. The nominations are due on the 17th, and the core values subcommittee will be coming together in early March to look at the nominees and give a recommendation to Dr. Gerard about who we think the top candidates will be. And then I told you about the speaker as well. Do you want to add anything there?
No, I just hope everybody's people are able to attend. I think it would be great to hear Professor Wilmot speak and talk and see the movies that he's done over time, and to see what he has to say about the state of America and diversity and cultural competency where we are today. So I think it would be great.
Do you recall the themes of any of his films? I should. I know I've heard them. And
He's done. He actually did
She-Rock with
Yeah.
She-Rock with Spike Lee.
With Spike Lee,
And he
yeah.
did a movie about Jayhawk.
He did
one
he did
about
one
Truman, and
about
he also did
Truman.
one about the Jayhawk. Yeah, so he's done several
Yeah,
movies.
he's very successful. Should be good.
Yeah.
So we're looking forward to that. Last year's ceremony was great and was well attended. So we're hoping that this year will be as well. The last thing we wanted to talk about, one of the third charge of our subcommittee was to develop a training module for people at the Med Center as they onboarded, and possibly even a yearly training module. And as we were preparing to start on that charge, we wanted to bring it back to the full cabinet to determine whether we still needed to do this, whether we wanted to do it in coordination with any of the other subcommittees, because we felt like the unconscious bias subcommittee might have some input into this. The programming committee might have some input into this, and so we wanted to find out what the rest of the cabinet had to say. Anything else?
Well, so we think it would be great to get together and to talk about what is needed for KUMC, the campus as a whole, for students, faculty, and staff, the education that is needed, instead of us working in silos. And not because we work as a group, but we think it would be good for all of us to get together to figure out what education is needed, what needs to be updated, and what we want included in the net dimensions education. So
Yeah.
we think it would be best to do that rather than us figuring out what everybody needs and then coming back to you guys and you say, well, we already have that, or we're doing that, or we already thought about that, and just work together as a group. Yeah.
So would it be most effective to get the leaders of the groups together to have a conversation and just see what the landscape is, or what do you? How do you see us moving
That was
forward
one
with
of
that?
the thoughts that we had, to have a meeting of the committee leads, to talk about how we wanted to approach this.
I haven't heard an update, but I know also in talking with Provost Benaputi that the College of Literary Sciences in Lawrence was working on one as well, and we might, if they've succeeded at that, we might have something we could look at it as a starting point to see if it's applicable and it has some material in it that would be of value to us or not. Do you have anything in the hospital?
Oh, coincidentally, at our first meeting, we talked about how we could touch all employees, and one of our first interventions was to really solidify diversity training that goes into our customer service training, because every one of our new employees has 8 hours of customer service. And Jennifer and Becky Moberg and I just met the other day because we have our framework. It's not finalized, but we want to make sure that it aligned with some work that Jennifer was doing, so it would be great. I would very much appreciate being a part of
Okay,
Oh, that's
you're
great.
doing
as well.
The customer
Very
service
cheap.
class I attended several years ago, and it was so great. I tried to get other organizations to do that. It teaches you about customer service and that everyone is your customer and how to treat and talk to people. So if you guys are still doing the same thing, I'm sure you've evolved. Thank you.
Yeah.
Since then, but it was great years ago.
We not to get sidetracked, but we did rework it about 3 years ago. And as Jennifer and I spoke about, we had a little blip in customer service training because it wasn't standardized. Some of us were addressing diversity, some people weren't. And one of our trainers just really had a blip in the diversity front, and so that just lit a fire under us to make sure that it's standardized and everybody's well trained to train.
So it'd be
Thank
good to get all of these groups together so we can make sure that we have one thing and we're not duplicating.
Right.
Yeah.
Leverage what already exists. And, yeah, that's a great idea. Thank you. And then as you do that, we'll need to figure out what resources we need to bring to bear on that. And then if you could reach out to Wichita and have somebody call in for that one as well, again, to make sure we're covering what the needs are down there as well.
Okay.
Great. Jamie, you're up.
Okay, Dr. Lisbon could not be with us this morning, so I will report on behalf of the committee. And the committee's had a couple of meetings since our last cabinet meeting and had some lively discussions. So I'll just, thanks to Jennifer, in terms of the bullet points, I'll just go with what's printed on the agenda and then make some comments. Since the last cabinet meeting, we updated the PowerPoint that we provided at the last cabinet meeting. So it's out on SharePoint, and you can take a look at that. Made some edits to that. We had some discussions with Lawrence in terms of looking at the framework that Nate Thomas and that group developed on the Lawrence campus, and we determined why reinvent the wheel. I think we could use a lot of the same information that's already been put together by that campus, and to look at it and see how we could tailor it to our campus here in terms of the diversity framework, diversity, equity, and inclusion framework. Jennifer, you want to sort of comment, because I know there's some email discussions that have been going back and forth with you and Nate.
Yeah, I think there was interest in having all of the KU campuses basically aligned to this one framework just for consistency and kind of the one university concept. And so they were really similar to ideas we'd already talked about in that committee. And so just really in response to their request and conversation with Jamie and David and the committee and Dr. Gerard, they decided to just accept that framework basically, which I can't remember if we've distributed that with this group yet.
I don't think we have.
I don't think we have. So
we could do that.
and I think there's some potential for a similar concept maybe to be discussed kind of at the Tilford conference level. So possibly having other institutions across the state all kind of aligned to this general framework. So I think the next step, at our last meeting, we talked about in our next meeting that we would really just dive into that framework and identify like where does this information live and who would be responsible for tracking it or implementing something, and just really sketching all of that out. So I think that's where we finished up last time.
And that's what, I mean, yeah, looking at 3 points here in terms of the framework, in terms of institutional support, curriculum and research, flexibility and goal setting and some of those things. So we looked at that. And then at our last, actually, subcommittee meeting just last week, we talked about preparing for next steps in terms of our committee work, but we wanted to wait until the outcome of the climate study to determine how we would address going forward. But the other thing that we looked at in terms of discussions, and the last thing I wanted to point out, I know that there's a lot of discussion on our campus here in terms of how do we communicate, how do we look at scheduling and events and all of that, and some of the frustrations that we had. I've actually had conversations with Natalie about that as well, because I think we all struggle in terms of understanding the events that are occurring on our campus, and so a lot of the overlap that we all face when we're planning events. We all can't attend every single one, but how do we coordinate in terms of making sure that the information gets out there and people are aware of it, and who coordinates it, who takes the lead, and making sure. So I've had some conversations with Natalie, and we're going to sort of continue to discuss that across the entire campus in terms of activity, as education, research, and all kinds of things on this campus. So that's our report.
Thank you. Any comments from Wichita? Or?
No, not at this time, thanks.
Okay. Unconscious bias, Diane. Sherry?
You start. You're the established person.
We welcome Diane as our new co-chair.
So glad to have her on board.
And Chair, I'm going to interrupt you right there because I was negligent. We have a couple new faces, so we should probably do a quick round of introductions. And actually, we're going to start there in Wichita.
All right, good morning. I'm Crystal Nevins, the Director of Human Resources.
Samuel Ofedodu, Assistant Professor.
I'm Stacy Wright-Haviland. I'm the Residency Coordinator in OBGYN.
Hi, and I'm Belinda Ventures. I'm the Associate Director of Public Affairs.
So I'm Diane Durham. I'm the Associate Dean for Faculty Affairs in the School of Medicine. Very happy to be here.
Cherry Young, Associate Vice Chancellor for Human Resources.
Kimberly Conley-Holland, Senior International Officer.
Doug Gerard, Executive Vice Chancellor.
Jennifer Keaton, Project Director in Dr. Gerard's office.
Sally Maliski, Dean of the School of Nursing.
Gigi Sears, Assistant Director of Professional Engagement from the hospital.
I'm Ashley Carlson. I'm the Assistant Director of Postdoc Affairs and Graduate Studies.
Maria Alonso, and I'm one of the directors of the Office of Diversity and Inclusion at the School of Medicine.
Robert Klein, Vice Chancellor, Academic Affairs.
Stephanie Webb, Vice Chancellor for Administration.
Jamie Caldwell, Executive Director of the Research Institute.
Margaret Smith, Assistant Professor in Family Medicine.
Geraldine McGee, Program Director and Clinical Assistant Professor in the School of Nursing.
Jordan Sanchez, I'm the representative for Student Diversity Council.
Welcome.
Irina Smirnova, Associate Professor in the Physical Therapy and Rehabilitation Science Department.
Our visit.
Chito Belches, Faculty, School of Nursing.
I won't get up. Well, maybe I will. I'll just. Here's my hand. Can't seem to get it. Anyway, I'm Ned Hunter. I'm a faculty member in the Department of Psychiatry. Here is an audience.
Margaret Okanaran, Assistant Director of Facilities.
Thank you for being here. Abby, quick introduction.
Abiodun Akiwanta, Dean of the School of Health Professions.
Great, thank you. Sorry to cut you off, Jerry. You're
Oh, no,
back
that's
off.
okay. So there's been work going on with the new curriculum for the School of Medicine.
Right, and I can update you all on that. The School of Medicine is revamping its curriculum, and one of the new programs that we need to make curriculum for is diversity for our students. And so we had a meeting recently. There have been some requests from the students to have some presentations to faculty to kind of make them aware about their interactions with minority students. And so we met with Maria and Jen and a couple other people to discuss how we might accomplish this in the School of Medicine. So Maria and her team are looking at how to create curriculum materials for the students, and then in addition we need to have training for the faculty so that they can feel comfortable leading the sessions that they're going to have as part of this new curriculum. And so what we've decided to do as a first step to provide some information to faculty is that Maria and her colleagues are going to do a presentation in May at a series of events that we sponsor from my office called the Faculty Advancement Series. Anybody can come, it's not just for faculty. But we're going to have them make a presentation, I think, about some of the Cook-Ross tools that people use for unconscious bias, as well as sort of just providing some examples of how faculty might just be more aware as they deal with students.
With regard to ongoing need for training, we would love to engage in the discussion because that's, where we've come to is that we need to integrate more education and training for all areas of campus. And so where do we focus? Where do we start? Who takes the lead on that? We probably need multiple leads across campus for the various communities that we have. And we also thought that it would be wise to see what the climate study results bring to help us think about priority of focus. So,
great.
I'd like to, Cherry, I'd like to have in the Research Institute, we've hired a training and education manager to look at training across research. And also, her name is Mary Hindle. I'll get you her name. She's been working with Ashley in the Academic Affairs Office in terms of coordinating different events. And I think in terms of just her skills of understanding training, she might be a good resource.
That'd be great. Thank you.
Dr. Gerard, I have
Yeah.
one more thing to
Yeah.
add. The School of Nursing right now, the Cultural Enrichment Committee is working on a survey that we're going to send out to our faculty to get their views about cultural competency, how they feel about it, is it important, are they including it in the courses? Because it doesn't need to be in every course, like things like applied budgeting, does it need to fit there? Maybe not, but we're seeing where it is threaded throughout the courses. So we're going to be doing that sometime this semester, and so I think that would also help to figure out where we need to fit things. Number one, how does faculty feel about it? Are they including it, and if so, where? So I think it's important to maybe think about something like that.
And maybe to add one more thing, I know it's available on SharePoint, but all the objectives for the School of Medicine have been mapped out throughout the curriculum, or we're working on it. We're developing things. But I think that it would be interesting to see if other schools are doing something similar, because the objectives should be valid for any health profession. The other thing is we are including a lot of stuff on our orientation. So there's going to be a change in the kind of like, if you will, the heavy, most of the objectives will be covered during orientation and introduction to doctoring. So that's the idea, that the students will get most of it on this month. But they're available to anybody, I think.
If I could add too, I see a lot of emphasis on the medical student side of School of Medicine curriculum changes related to a lot of the trainings that we're doing, but I'd like to make sure that we're being mindful of the graduate students who aren't medical students, and making sure that we're touching into where they're training and making sure that it's available to them.
And School of Nursing.
Yeah.
And health professionals. If you could give us an update on the initiative that you're doing next go around, that would be helpful to inform that group. So, Jenny, are you going to be the convener of this group of all the minds?
Yes.
Good answer, Jennifer.
I will convene. The first focus area of the strategic plan is people, and the description of that focus area is develop and support a world-class, valued and respected workforce. And so it'd be nice to be able to capture whatever is going on. I mean, this just be a really important piece of that objective.
Yeah.
Excellent. Student Diversity Council. Jordan, you're it.
Hello.
Welcome.
Yes, thank you. So nice to meet everyone. So we are just transitioning, so I'm new to the Student Diversity Council, but you guys remember Brittany. Brittany wanted me to inform you that the holiday event went well, that multicultural luncheon that they had that past time. So we just transitioned, so there's 7 of us right now on this board. For Student Diversity Council, we actually added 2 new positions, community activist and diversity of education position. So we're hoping to at least broaden our outreach to students with that. Hopefully provide a little bit more opportunities for students to get involved in the community. One thing I know, we've just had our transition meeting, nothing set in stone. I think we'll be having a transgender panel in the springtime. And one big thing I know I heard was we're trying to reach out to more of the different schools besides just School of Medicine, because that's predominantly what the council is right now. And so we're looking to see how we can include the other schools into our initiatives.
That's great. Thank you.
So do you have any representatives from the School of Nursing on there now?
No, so we sent, that was open to, I know, health professions and School of Nursing. We have an MPH, and then the rest is going to be School of Medicine. We didn't get any feedback from any of the other schools, so we're going to continually reach out to them and see if we can get them involved.
You will.
Okay.
You got that, Abby? Excellent. Gigi, you want to give us?
Oh, absolutely. We've had.
You're kind of far from the microphone, so could you either start again or I'll shout.
Oh, this is the first time I've been in the studio.
I know. Yes.
Phone. Okay.
Sometimes hard to hear if you're not close to the microphone. So.
Sure. So I mentioned that we'd had an opportunity to collaborate with Jennifer on our diversity training, which was really a wonderful conversation and led to so many other conversations that I'll speak to. But because of that collaboration, Jennifer the things that you're doing on the university side of the campus. You have so many great opportunities and education events, and we just didn't have a great mechanism for dissemination. So Jennifer has been feeding the information, and we had the Black History Month events posted on our 24/7, our landing page now, which is wonderful. Since our last meeting, we had an education event that featured Dr. Kimberly Vandergeest-Wallace and a transgender panel, which we had over 100 attendees, and just really the people walking out said we need more. And they've been invited back to speak at a nursing symposium in May. And that topic was really geared towards more the caring part for our transgender community, but it led to a lot of clinical concerns about lab reference ranges in gender and med dosing. And so we're convening a group of clinicians and nurses and pharmacists and lab reps to try to address this very complex it's just a very complex medical situation, and so that will be very fruitful. We have some good people that have been identified. To that same point, our electronic medical record and EPIC hasn't been great for supporting people that are transitioning in gender. So our IT folks, within the next 3 or 4 months, there's still just the binary male-female. It's a hard stop. Although the same day as the transgender conference, we found that there is an unknown category that nobody knew about, and somebody used it, and it was really bad. And that's how we learned about lab reference ranges and gender. There will be, in 3 to 4 months, they'll have preferred gender as not an option for the hard stop, but it will allow us to capture if somebody has a preferred gender, and the longer term fix is longer term. In September, we're holding a culture conference, which again, I'll just say it's been nice to collaborate with you all, because I found out from Jennifer when you have your conferences, and the topic being refugees, so we'll take that off of our plate. And that will be September 14th. At our last meeting, I mentioned we had identified in our gap analysis that our education fairs were really focused on degree seekers. And we identified that we had our entry-level staff, the diversity, the demographics at our entry-level and demographics upward were not similar. And so we held an education fair that was focused on people that were seeking programs. And so we held that, and we had 50 attendees, and the number one program that they were interested in was medical coding and billing, which is very important to us. And one university said, if you have that many people, we'll come on site and teach the classes. And we had the Full Employment Council there, and they had 38 people that wanted follow-up for financing through that, so that was really great. Our Healthcare Equality Index work group, that's for the Human Rights Campaign. It's not an accreditation, it's a designation that we have to put together a group to fulfill those requirements and make sure that we're meeting all of those things. And so one of our needs that we identified in our first meeting, and Jordan, maybe you can help me with this, we need to meet, and also you, we need to meet with the LGBT groups in the School of Medicine and School of Nursing and begin conversations there. That's one of the criteria. I would love to get the tool that you're using at the School of Nursing for your survey of faculty. That would be so helpful. And Terry Risconi's reached out to our media department to try to create a video that mirrors one that Cleveland Clinic did. That's called One, and it features diversity just in that welcome to our organization. This is who we are. And if you haven't seen the Cleveland Clinic one, it's fabulous, but we hope to mirror that here. Speak to our culture on this campus and across the system.
That's great. You know what, I think we all face challenges of trying to Jamie's point, dissemination and communication, and it gets daunting in your world when you start looking at 10,000 people that you're trying to get this across, and how do you do that? And so I think the more we work together, the better.
Yes. Thank you.
Yeah, very true. Jane, you want to run through announcements for us?
Yeah, just a few things coming up. A couple have been mentioned already, but there's another Safe Zone training at the end of the month. Ryan Gove helps run that, and that's for learning about LGBTQ issues. And so they've really been expanding the number of people who've gone through that training and the number of times they offer it. So it's really good. Black History Month, I mentioned earlier the last event on the 28th. And we have a town hall coming up in August, March, to talk about kind of our, really it's just kind of a diversity update town hall that we haven't done for a while, and talk about the climate study and, you know, future action items that will come out of our group. And I think we mentioned the rest of these, so.
Can I add something on the symposium? Sure. I thought we had run out of time, so I kind of ran through that, but I just wanted to say that Dr. LeMaster and Dr. Baird are in charge of the content for the symposium, and there will be continuing education credit. This is just the Save the Date flyer, which I think is beautiful. Alexa Smith did it, but we'll be updating it with the speakers and the actual agenda for the morning. It's going to be very broad, and that it'll be what, you know, a definition like Refugee 101, and what does it take to care for a refugee. And so it's going to be very practical for healthcare providers, very informative. I think it'll be something, though, that you could come in and out of. So if you can't give your entire morning, when you see the schedule, you could possibly pop in just for the noon, you know, main lecture, or you could come in just for the first, you know, Refugee 101 in the morning. So we will be getting the agenda out very soon. We're just waiting to tweak a few, one speaker actually.
And this will be ITV and live
It
stream.
will.
It's in nursing, we can do that.
Yep, all of that.
Excellent. Great. Anybody have anything else they'd like to bring to the attention of the committee? Crystal, you guys have anything down there?
No, thanks for including us on some of those committee requests from earlier. We'll be following up on those. Thanks.
Absolutely. If there's anything else we can do, please let us know. Okay. Thank you, everybody. Remember, nominations for Diversity Award and nominations for filling vacancies coming up, or if you would like to re-up, be sure you do that as well. Thank you.